Good afternoon, everybody. I hope you're all doing excellent today, and we have enjoyed the NASSCOM product conclave sessions thus far. My name is Deleep Murali. I am the CEO of Zscore. Zscore is a smart data platform that increases data usability in organizations. Today, I have the immense pleasure of speaking to Dr. Sujoy Kar. Dr. Sujoy is the Chief Medical Information Officer and Vice President at Apollo Hospitals. Previously, he was the Medical Services at Apollo Gleneagles Hospitals, Kolkata. He obtained his postgraduate MD in clinical microbiology and is an alumnus of the MIT Sloan School of Management. Dr. Sujoy is currently associated with IIM Calcutta as an adjunct faculty for healthcare analytics and management. His current and ongoing research interests are in adoption of artificial intelligence in healthcare, digital health platforms, and design thinking in healthcare. That makes him a very, very interesting candidate for today's talk, and we are very excited to have him today. I welcome Dr. Sujoy for this event, and we are in for a fascinating chat today. Dr. Sujoy, welcome to NPC's deep dive session on the future of digital health ecosystem. How are you doing today?
I'm doing fine, and thank you very much for the wonderful introduction, Mr. Dilip. This is really a wonderful privilege for me personally and for Apollo Hospital to be representing here at the NASSCOM Summit.
Absolutely. So, when we were thinking about discussing with you, one of the things we thought was we'll pick your brains as much as possible. Everybody here is, and at the same time, very eager to know about how technology is progressing in the healthcare sector, especially post-COVID. So, what are the key learnings from the recent COVID crisis that we saw during the second wave? How do you think we could use technology to be better prepared to prevent or manage such a crisis in the future?
Great question to begin with. I think one of the most important thing is to focus on two words that we always hear. One is, of course, innovation, particularly digital or tech innovation perspective, particularly in healthcare perspective. And then, of course, the agile resilience part. And we'll come to the innovation part because, it is very important for healthcare organization, for startup, for the entire ecosystem around health tech or healthcare organizations to maintain the innovation momentum, which would be critical to be continued for an effective response. We are not yet out of the pandemic. We are still struggling with newer strains coming in. So we would have to be on a path often or have to maintain the innovation momentum which we have gained over the past few years, past few months. The other thing is that I think which is very fundamental for any organization is to get into a mode of agile resilience, wherein we are talking here about, particularly from a healthcare organization's perspective, to set up structures within the organization that would help in rapid decision-making, create networks that would help within the organization and also to the ecosystem for the industry, the startup, to the community, because that's where you deal with. And the third point is about culturally to empower your worker, your healthcare worker, ever so much, because they are the people on the ground. They are the people who are dealing it on a day-to-day basis to actually do that. And fourth, and the most important thing that we found out during this period is to equip people with appropriate technology that they need to do the work, whether it is in terms of, giving them a digital thermometer, as simple as that, to the state-of-the-art technology at the back end where you are looking at how do you go about in doing multiple CT scans for people who are coming with COVID, or analyzing those CT scans, a numerous number of CT scans or others, or chest X-ray to understand whether, some people have COVID or not. So these are some of the things that we have to see from an innovation perspective, from an 24/7, which ensured that we could reach out to about close to 3,000 patients per day through seamless video consultations. Right, which we were possibly not doing to that extent before the pandemic had hit, and then fulfilling medication orders up to 5,000, 6,000 prescription orders per day. Then we had something which we developed in-house as a program. We called it Apollo Kavach, and we got it published into NAGM Catalyst, where we had utilized close to 80,000 hotel bed nights, where we kept in people who were having minor symptoms of COVID in those hotel rooms, and monitored them with our nurses, our doctors, 24 hours to see, how they were faring. And, touch wood, most of the patients, in fact, all of them could, recover and go back to home. On a technology front, I don't know whether you know this about or not, we launched a COVID scanner, a very simplistic COVID scanner for our 24/7 platform. And in a span of 3 months, starting from, April, May, June 2020, and then later on, we had 16 million scans.
Wow.
Right, 16 million scans that could actually tell people whether they are at the high risk or moderate risk or low risk of COVID, and they could then go in to meet their doctors or do a virtual consult and all of that. And this was there with the Airtel, this was there with the Microsoft Bing, this were guiding a lot of state governments as well. So these were the rapid innovation that we had to do, from the technology front, from the, from the operational aspects to it, to actually get there when we were, responding to this crisis.
It's pretty interesting because there are three things that come to my mind post what you've said. One is that you've touched upon a lot of design thinking, especially rapid innovation, rapid experimentation, empathy, a lot of those key factors. And I'm a big fan of design thinking as well. And the other aspect is the innovation part. And the innovation, especially around the scanner that you were talking about, do you plan to actually launch it in the market as a product that people can buy, scan themselves, or is it something that you still have in the works right now?
No, so this scanner was mostly utilized during the initial part of the COVID, in 2020, and then we integrated a cough scanner on it, where people could give a cough sound, and we could get into much more precise decision making, whether the person required immediate attention or not. But if you were asking me from an innovation perspective, to go about accelerate innovation and typically what we call as nail, sail, and scale.
Exactly.
You first have to crack what you are trying to do, and then you sail it, take it to the market, and and then scale it up. I think we need to have 3 or 4 fundamental things from a business model or strategy, particularly for innovating or accelerating in health tech. First, you would have to choose the correct portfolio of innovation, and you have to bring in your resources and manpower to do that. And it is important that you prioritize with the health needs and channel care processes according to this, because this will help you in doing that. One of the examples of this, which is non-tech example, is this, that even during the COVID surge at Apollo Hospitals, we continue to do life-saving surgeries. So, it is very important for organizations to set priorities that are related to their ultimate objectives to reach out in that. Second, after choosing, you need to evolve fast. That the whole journey from physical to virtual platform overnight and doing it seamlessly is very, very important, because that gave customers flexibility. So what we require at the moment is the flexibility from organizations to make their product, as you said, as more of a service, which would be then, taken into a surge, and it can help out in a demand condition like that what we had in COVID. Third, accelerate. And the whole accelerate process is a very important thing, and we saw it in vaccine delivery or in vaccine discovery, right? And another beauty thing about the vaccines were that the competitors, the pharmaceutical competitors, were coming and joining their hands to give you something which was immediately required. I mean, that would be completely unheard of in pre-COVID era, is something that we saw. And then, the last one is you will have to choose your collaborators, extend your collaborators where people are able to change things in overnight and do things. Car manufacturers were building ventilators,
Absolutely.
right? And then there were numerous tech companies who were coming with COVID algorithms and others using data, using AI, and seamlessly working on that. To answer your question on whether we want to take as a product and take it to the market, I think for COVID, we will always say that we would keep it as something that would be usable around the world. And of course, we have a publication on this on Nature, where we have an URL, people can use it and use that. This is the work that we did on identifying people with their outcomes, with getting some clinical features and lab markers at the time when they're coming to emergency room.
Okay.
So by just doing that, what you could do is you could allocate resources, you could have a very fair conversation with the patient's family and tell them about the expectations, outcome expectations about the patients. And then, of course, do as much as you can do to save lives.
It's actually very impressive to see empathy right now being brought into healthcare. So, and especially maybe a conversation for later, but I'm excited about the fact that post there's a SaaS, there's a PaaS, then there's probably healthcare as a service. So it's all happening right now, isn't it?
Yes.
So in this post-pandemic era, what are the problems that Apollo and other similar hospitals are trying to solve? Which are the areas and the problem areas you think startups help you solve? That is also something we wanted to touch upon.
Absolutely. And I think there is a lot of opportunity for startups or for broader from tech companies to work with healthcare organizations to solve a lot of problems that we are seeing even during the pre-COVID era. Now that we have COVID and post-COVID scenarios, there are plenty of those. So I will break it down to, again, 2-3 pointers, and I love talking in pointers because that actually helps people to understand where we are going. The number one is clinical, and so Dilip, we are seeing a surge also of growing non-communicable disease burden across the world. We're seeing a surge of diabetes. We're seeing a surge of heart disease. We're seeing a surge of kidney diseases, liver diseases, and you name it, stroke and all of that. And somehow we have a feeling that there is a way that the COVID could have actually accelerated in many patients because of the lockdown, mobility, the diet choices, the mental health, the perspective that we are looking at. So entities are definitely going to be one of the problems that we need to solve. And many of our AI work our analysis work at Apollo Hospitals is directed towards this, which we invite a lot of startups to come and co-create with us.
Okay.
Second area, which is very important, which is not a non-communicable disease, but more from a communicable disease perspective, is the problem that we are facing in antibiotic resistance.
Okay.
And this is again something which is not an Indian phenomenon; it's a global phenomenon. And I have had experts from WHO to the government of India to different organizations who are really worried at the patterns of antibiotic resistance that are emerging worldwide, and particularly at the community level. Because of the rampant use of antibiotics over the counter. And the pressure that it puts on your higher areas of care, like your treatment at hospitals, treatment at tertiary hospitals, or even at treatment at tertiary ICUs, right? Where the antibiotic resistance goes up the ladder, and then you have very little choice to actually give it to the patient. Is there a way that technology can help? And we are working on this. On what we call as an empirical antibiotic recommendation system, using similar technology that Netflix uses,
Okay.
See how we could use that same thing in building an antibiotic stewardship program, which is about the right choice of giving antibiotics to the patient. The other thing is very important from a clinical thing, and I invite a lot of startups to actually come and work with us on this, is the effect of COVID, long-term COVID, on mental health, on elderly comorbid population. And another area where, we do not know yet what the actual outcome would be. It is about our children. What the 2 years that they are now at home, doing their classes at home and doing all of that, what would happen to them when they grow up from a mental health perspective, from the NCD perspective and all of that. So these are things which we would like to look at from a clinical problem solving. We also need to look at it from a supply chain perspective. And it was quite open, the dependencies that we had in supply chain, and the reason why we were stuck with PPEs or ventilators at the beginning of the COVID crisis. How do we build resilient supply chain systems within our country or within our healthcare ecosystem, so that if there is a surge again, we can address them appropriately? Coming to the problems to be solved from a technology and data perspective, we have challenges that startups can solve for us. It is about how we securely collect the data at the last mile. From the patients, from the doctors, and what is the incentive that you are going to give it to them for sharing their data, right? Or for the doctor to actually do the input to the data. And then when you have the data, how do you go about in analyzing and modeling it? And Mr. Deleep, I talked to you with a report that came out at MIT Technology Review sometime last year, from a publication that came out from Oxford. And it talked about that most of the AI models that were built during COVID didn't work, right? And
Yes.
we know why they didn't work, because we were possibly not looking at accuracy, efficacy, safety, inclusiveness, and the nature of bias that was creeping into it, right? And final thing as a problem that I want to talk to all my tech colleagues or colleague friends on this is that designing something in healthcare, we would also have to understand that we have to make explainable systems. We cannot build black boxes in healthcare. What you build as a technologist or a data scientist or an engineer, you would have to explain it to your doctor so that he can go and explain it to your patients. And this whole trust journey or the trust flow has to happen in such a way that it is meaningful at the end of the patient to use those AI-based technology that we have to actually make the maximum use of it.
This is fantastic, because you've touched upon key areas. No, one is you mentioned about data privacy, okay, and that is a key. You've touched upon data usability, okay. You've touched upon explainable AI, okay. All these three are the hottest areas right now from a data perspective, and these three are what should I say, the building blocks for a successful AI model in the future. So when we look at 10 years down the line, when we are talking about a complete AI world, without these three, AI is not going to be really successful. So thanks for sharing. Really insightful. Coming to the next, impact of COVID on business model, strategic priority in the healthcare sector.
Yeah, from a business model, again, we would go into something where we are talking about digital acceleration, which is very, very important. Healthcare cannot afford to be a laggard in digital adoption. And we see this, that there is a lot of talk about that the doctors do not want digital transformation and stuff like that, which is wrong. I think a lot of doctors are now savvy. They want to adopt, and I'm talking about senior people doctors who are above 60 years and all, they adopted to the technology, virtual platforms so easily. We always had a worry whether they would whether take or not. The second thing is, from a conceptual perspective, look at what the remote care can bring to you. And again, this is from a healthcare strategy or business model. You need to see this, that at Apollo, we did this 20 years back. We started this journey, our beloved chairman started this journey with Bill Gates in Hyderabad, somewhere in the year 2000 when he visited India. And at that point of time, there were a lot of talks about it, that how it will eventually shape up. But at 2020, March 25, that's a landmark day for India, when that the digital, the telemedicine guideline for India was finally given out, and we knew how we do that. It took 20 years, but then we reached out to that. Now you have an enormous opportunity in remote health, whether it is for the existing healthcare companies or for the startups to build and take it into that. The third point is about collaboration with organizations and institutions, which would help innovate with vast amount of data, with clinical knowledge and expertise. But I think all of these needs to go with prioritizing your innovations to unlock growth, particularly in this recovery phase of COVID.
Very interesting point, because out of the 2020, milestone that you said, I'm glad, because something related to technology, something related to advancement has happened in 2020. So I'm pretty sure Dr. Abdul Kalam would be really happy somewhere or the other hearing that the country has proceeded in some direction and met at least one of his dreams. So very, very happy about that. The other thing I wanted to ask you was, what is Apollo's focus area in AI in the health space? Where are investments likely to flow in the near future?
Right.
This is for our startups, so that they know how to trouble you.
No. So it's not trouble. I mean, we would be more than glad to actually participate in any discussion, and then if it matures, to actually get them on board for any project that we would like to do. Practically, the way we are looking at it is, I talked about the NCDs. These are the areas, because you gotta understand now that not only Apollo, but in many of the healthcare organizations around the world, and even in India, now we have very mature data sets which are available on the longitudinal patient journey. And when you have longitudinal patient journey and a large data set to actually help you build models, you can use them in any ways that you want to use them. You can use them to look at a temporal behavior over a period of time, look at risk assessments, look at recommendation system, also look at causality, right? In order to say that the kind of with the kind of parameters that a patient bring at that point of time, what is the best possible treatment regime that you are going to give, right? Which will have an effective outcome on, for antibiotics on day 7, for something like a chemotherapy on 1 year survivability or 5 year survivability. So you now have that longitudinal data on which you can possibly build on and get those kind of inferences. So that's from the data and the tech perspective. But I think there is a framework on which we work, and I'm going to share this framework. We call it EASE, EASE.
Okay.
So E stands for ethics, and all of those things that you've just talked about in terms of privacy, in terms of safety, in terms of accuracy, efficacy, unbiased systems, and all of that. So that all comes into this. The second one is A, which is about the adoption, and that is something always goes into the mind of people or innovators. Will people use it at the time that when we are preparing something like that? So adoption to the workflow of the clinician, adoption to the workflow for the patient so that they can leverage the maximum benefit out of it. And then the S stands for suitability, which is like what works, what does not work. And if you get that kind of an understanding, bringing clinicians into the room at the very first step of defining a project, you have done it. You would know, why, what that would be helpful for them. And the last E is, of course, the work that we are doing on explainability part, and we have already discussed about it. So in a very simple way, I would, if there is a take-home message for anyone here, how do we work with these? How do we work with ease, right? The ethics, adoption, suitability, and explainability.
Absolutely, and thanks for sharing the secret recipe. So I'm pretty sure you will get bombarded with emails from a lot of our viewers. So I'm not responsible for that, though.
I'm fine.
But I also wanted, for the previous point that you mentioned about doctors and technology, one of the things that I have always found is that doctors are neither averse of technology. It is just that technologists need to understand with empathy what are doctors, the environment in which a doctor works. Okay, and technology needs to suit that. So, and that's something that I think is going to be learned. It cannot be taught. Maybe somebody, maybe me, would eventually crack that at some point in time, and we'd be able to set an example, me or someone else. But that is something that is critical. So thanks for bringing that up, because it was important that we understand that at the end of the day, doctors are humans, and we need to understand how they work and provide technology to them that is usable for them and not for the technologist. So thank you for that. And one other thing, now having spoken about the focus areas, how is Apollo preparing to use AI in healthcare? What are the areas that you think you can share with us?
Right. So that's a great question. For us, we call it a 9 yards of getting into the entire building of a clinical AI, starting with initial consultation with the doctors, then going through our data, then the analysis. Then, of course, one of the very important aspects of doing this work is to go build appropriate ethical approvals in the process. Because, it is important that we are dealing with human life. We can get a little bit overboard with the data that we are getting, but sometimes it could be just a statistical inference or a noise, as we could call it, and then that we do not want to make any meaningful models out of that. Validation. And validation or replication of your model, not only within your own data sets that are from other hospitals in a large group of hospitals like Apollo, but also replicating it in public hospitals, at government hospitals. If you are able to replicate those same results, then this is going to be very important. And then replicating it outside the country. Right. So typically for the work that we did on cardiovascular diseases, what we call as an AI CVD, or for the work that we do in pre-diabetes or in the liver that we have been doing, we are reaching out to organizations outside Apollo, outside India, by the use of federated learning, where we are not taking any data, but we are extending our APIs so that the APIs are called into their data sets, and we can get the inference on that. And the idea is the whole process of validation, calibration, and co-creation with all of these organizations. So this is one. The next is the step where you are looking at pickling those files or algorithms and bringing them as an API. And that API which you can integrate into your EMR for prospective use. So what does prospective use helps you in getting more data, but also making your models finer, but also giving a chance for the model to actually do a real life use of that. And at some point, you have to go and build data consortiums across the world and also get through the regulatory approvals.
Can I ask you one question here? Do you have like a sandbox kind of an environment where people can actually get in, startups can come inside, they can register or sign up a small NDA with you and eventually use some of the data sets that you might have and create magic and reach out to you. Is that something that you currently have or are
Yes,
looking
we
at?
do. Yes, we do, and would absolutely love to do it with organizations.
Absolutely.
Yeah.
Perfect. That is fantastic. I think that's a great takeaway for our startups. I think we're short of time. I think we might have just one more question. So, how do we increase adoption of AI solutions by hospitals? What are the possible issues that you see as potential dampeners?
I think one of the most important thing, and I'll just stick one point here. In fact, I'll talk about two points.
Go ahead.
So the first one is building trust into the system. How do you build the trust into the system? And how does that trust flows from your algorithm to the clinicians or the clinician's workflow and then reaches to the patient? That is most important, number one. Number two is, how does it bring about ease of use for the people who are doing it, right? So if you have been able to solve these two problems of ease of use and the trust, I think, the adoption will come on its own.
Okay. And what are the potential dampeners that you think would eventually?
There are many. I talked about the 9 yards, and you could say that at every steps there are potential dampeners. Whether it is about the data quality, whether you want to go or whether you want to go with a CCA model or whether you want to go in a multiple imputation model. And then you start working with the data, what's the kind of modeling that you want to do at some levels, at technology levels. Then, going through the ethical process, validation, time. Sometimes it is frustrating because, you are working with different organizations. Sorry to use the word organisms, but organizations.
It comes by habit, doesn't it? There's certain things that are so entwined in the blood, it just doesn't get up.
Yeah. So organizations and all, and they have their own way of working, right? So to actually get in that. But ultimately, I think, you will end up, once you go through the entire cycle, you would end up with very positive points, which would actually help you to accelerate the process. So when we build our first model and put it onto our EMR, it took us almost 2.5 years. Now we are able to do this in 3 to 6 months.
Fantastic. Thank you, Dr. Sujoy. It was a pleasure talking to you. I have so many other questions around mental health, around about teenagers. I have a teenage daughter as well. So a lot more questions to ask, but unfortunately we don't have time, but it was an absolute blast talking to you. So thank you for giving the time, and it was a pleasure meeting you as well.
Absolute pleasure. And I think this is just the beginning of the conversation.
Absolutely. Thank you. Thanks a lot.
Thank you very much.